The main focus of the Children's and Maternity Clinic at the ESO is to provide holistic care for mothers and children and to help them to achieve their health potential. We use really gentle methods of examining and treating children, and so it's safe for children of any age to come and have treatment with us. The osteopathic approach is really useful for mothers and children because it acknowledges their wholeness. It acknowledges them together in their first year of life, and it also acknowledges where they've come from. So in the children, when we take a case history about a small baby, for example, we'd be very interested on how the pregnancy was with this child, how the birth was with this child, what influences this child might have been under. And the same is true when we assess or examine mothers while they're pregnant or after their pregnancy, that we take into account all the influences they've been under. I have a passion for working in the Children's and Maternity Clinic for at least two reasons. One of them is that I really enjoy seeing patients get better. I've come from a midwifery background before I became an osteopath, and I often saw women there suffer pain with back pain, shoulder pain, neck pain, and they were told that nothing could be done for them while they were pregnant. And osteopathy is a really safe method to treat any of those pain complaints during pregnancy, and so I'm grateful and passionate for that. The other aspect is that I really like seeing the students develop within the teaching clinic. They enter their fourth year being possibly a little bit nervous about treating children, and we guide them, we give them lots of one-to-one time as tutors, and by the end of the fourth year they're competent at treating children, and that's always an incredible journey to witness. A normal first patient encounter at the ESO clinic would always start with a very in-depth case history. So we would take 20 minutes, half an hour to learn everything there is to learn about that patient and their background. So that could be a medical background with operations, surgery, accidents, things like that. And a child, it would more contain their history of their pregnancy, their birth, maybe their first few months of life, their development, when they started walking, sitting, things like that. So once we have that history, we would then move to an examination, examine the whole body. We would always not just examine the area of the body that has got a complaint or has got a symptom, but that we would examine the whole body. And then we would devise a treatment and management plan from that, talk with parents, and if the child is old enough, the child about that, and then propose a treatment plan. I love working in a teaching environment as much as I love working in my practice, because I can pass on my experience to students. I think osteopathy for children should be something that every osteopath should be able to do, and so I'm really happy to pass on my experience. It's also very fascinating to watch students develop. It's fascinating to watch children develop from their first few little crawling movements to being able to walk and talk and develop into a mature being, and it's fascinating to see students develop into mature osteopaths. We work as part of a network really for healthcare in the ESO clinic, and most osteopaths do in private practice as well. We've got good connections to the local midwives here. We've got a good working relationship with tongue-tie practitioners, the local GPs, breastfeeding groups. So we really see ourselves as part of the network that looks after mums and babies.